Hi friends, I am Dr. K.Senthil, dental specialist for teeth beautification. In this video, we are going to see cases of fixed teeth replacement in which we have given an excellent smile with our beautiful teeth. As we proceed further, if you have not yet subscribed, kindly subscribe because we are one of the very few dental channels who are focusing on simplified dental treatments. Now we will get into this case discussion. Watch the video fully to have a better understanding of the treatment. This person has lost almost all of his right posterior teeth. As a result, he has been using only his left side for chewing, and this has resulted in the joint problems. Though he was trying to manage this problem for quite some time, he could not continue this further. So he wanted to have his right side teeth also replaced soon. Going forward, the patient wanted a once for all treatment wherein he wanted to have all his teeth replaced, and at the same time the remaining teeth also should not give any problems in future, and also a bit economical. Keeping in mind his expectations, we went ahead analyzing the remaining teeth also. The right lateral incisor had a decay previously and was discolored badly. So a few years back itself, we did a root canal and put a crown over it. Summarizing the findings, on the right side, all the three upper molars and the second premolar was missing. The first premolar is totally damaged. The canine seems to be fine. The right lateral incisor, which is already root treated, will be a bit weaker. The central incisors are showing signs of mild decay and food trap in between their proximal surfaces. Then the left lateral incisor is missing. The left canine is good. Other teeth doesn't need intervention. Based on the findings and the expectations of the patient, we have arrived at two types of fixed teeth replacement. One is dental implants, another is fixed bridge. If we choose implants as a mode of treatment in this case, on the right side, first molar, second premolar, and on the left side, lateral incisor can be replaced by implants immediately. The right side first premolar, which is already broken, needs to be removed, and after sufficient bone healing, we can place implants. The upper right second molar was not considered for replacement because of financial reasons. Finally, at a minimum cost of rupees 20,000 per implant and a crown, the total cost for 4 teeth comes around 80,000 for the entire process. Now we will analyze about the option of dental bridge in this case. The salient features that we have to note is the right molar needs to be replaced by cantilever option only. The right first premolar needs to be built up for a crown. The right lateral incisor, which is already crowned, needs to be removed. The other remaining teeth we have to go for crown preparation. So there will be a total of 9 units, as you can also see in this picture. Regarding the cost, we have two types. A basic one at rupees 3,500 per unit and an advanced one at rupees 5,000 per unit. For this case, we have used the advanced type of ceramic. Now we compare the salient differences between implants and the bridge in this case. Implants had the only advantage of not grinding the other teeth, but implants could not stop the decay of the remaining natural teeth. It cannot stop the other teeth from getting mobile. But in the case of bridge, though we grind the other teeth, it protects the other teeth from getting decayed and also prevents the teeth from getting mobile in future. Also, comparing the cost, the dental bridge cost is only 45,000 compared to implant cost of 80,000. So considering all these advantages of dental bridge over implant, the patient went for dental bridge. As we see now in this video, the crown preparation has been done. Next we take the impression and send this to the lab. In the lab, I myself do the designing of the teeth, giving importance to every minute detail. I have set my standards so high that every patient who comes to my clinic for teeth replacement should have the best smile they would have ever had. So, after ensuring that the teeth is made nice, it is now fitted in the patient's mouth and checked for its placement and perfect fitting. The patient is now asked to bite and see whether if there is any discrepancy, so the patient should not feel uncomfortable even from day one. Finally, the bridge is fixed with a permanent cement. Now you can see how beautiful the teeth is. Whether the patient talks or not, my teeth will talk to boast its beauty. Not only this case, you will have many cases of my teeth beautification videos coming up very soon. If you have not yet subscribed, subscribe to watch them all. Thank you.